Social determinants of health are shaped by the distribution of money, power, and resources throughout local communities, nations, and the world. This phrase also includes the different structures, such as the economy, environment, healthcare, and societal factors that influence a person's life. While the patient and family centered medical home may not be able to address all of the global issues encompassed by social determinants of health, focusing on specific health related social service needs can empower providers in the medical home to take the first steps at improving these aspects of health. Sometimes, unintentionally, we may overlook the non medical needs of patients and families. Clinicians are trained to think about all needs related to health, but not necessarily about a patient needing housing or adequate nutrition. Let's take a closer look at the determinants of health. Determinants of health are identified in several categories: behavioral, like smoking, alcohol use, or diet; genetics and biology, like age and family history; social, like race and ethnicity, education, and housing; healthcare, like access to care and insurance; and environmental, like pollution and access to green space. Poverty, housing instability, food insecurity, education, unemployment, and violence are some examples of non-medical issues that could affect a family you work with. Though these issues are not always directly related to healthcare, there are referrals and services that you can connect a family with to help them address these issues. Ideas for services include income assistance, housing assistance, food assistance, education resources, job training, and counseling services. Often, clinicians aren't trained to readily identify and address social determinants of health during a consultation. In fact, a survey conducted by the American Academy of Pediatrics found that 76% of pediatricians feel that they should inquire about these issues, but only 40% feel comfortable advising parents, and only 33% feel that they have sufficient training to have these discussions. As care coordinators, you have the opportunity to address these issues with the patient and family. You also have the opportunity to educate providers to look for these signs. Social health determinants have a direct impact on the patient's and family's health and well-being. Barriers to screening also exist. Because their medical training does not focus on these social issues, physicians often believe that these issues are outside the pediatric domain. Based on the American Academy of Pediatrics survey, physicians rated themselves as having insufficient knowledge to know how to screen. They also indicated that they lack confidence or self-efficacy to advise patients, are unaware of available resources, and have difficulty accessing the referral process, or are unsure about available resources and services. In addition, physicians cite a lack of time and lack of reimbursement as barriers to screening. Most visits last about 10 minutes. Therefore, they do not feel having the time appropriate to address medical issues and social issues. This type of screening is also perceived as an unbillable service, therefore not required or mandatory. There are social history questions that providers can ask patients and families to uncover challenges they may be experiencing and address basic needs. These questions can be included as part of the medical history and used in general conversations with patients and families. Examples of questions include: do you ever have trouble making ends meet? Is your housing ever a problem for you? How is your child doing in school? Is he or she getting help to learn what he or she needs? Do you feel safe in your home and in your neighborhood? As you reflect on the social determinants of health, consider how you can be aware of these issues and address your patient's needs. Questions to consider include: what tools do you currently have to screen for and address health-related social service needs in your practice? How do you connect your patients with community and social service resources? How do you follow up after referrals? What other strategies or tools could be developed to enhance providers' ability to identify and address health-related social service needs? Remember, children and youth with epilepsy need to have open access to high-performing care coordination. There are many medical and non-medical issues affecting patients and families. Care coordination is not an independent approach. It is a team effort.